the perfect blend of modern and natural medicine. We're trained in labs and diagnostics, and we use them to help guide our treatment. We use the least invasive natural treatments to help stimulate the body to heal as our primary intervention, but we also are trained in pharmaceuticals and use them when necessary. Some people want to know how we're trained. We are trained in a 4-year postgraduate residential naturopathic medical school. So we all went to undergrad for 4 years first, applied to naturopathic medical school, and did an additional 4 years. We learn the same biomedical sciences as an MD or a DO, that's such as anatomy, physiology, biochemistry, etc. We also will do pharmacology training in the same number of hours that our conventional colleagues do. Where we really differ is our therapeutic method, focuses on nutrition, botanical medicine, homeopathy, etc. In my particular school, I went to school in Arizona. We learned acupuncture as well as physical manipulation and a few other modalities as well to really help find the right method to help restore balance and stimulate the body to heal. So the naturopathic philosophy is really at the root of what everybody who is a naturopathic doctor does. Because we've got so many options in how we learn, so many quivers or tools or arrows in our quiver, we've got a lot of different ways that we can approach treatment. So seeing one naturopathic doctor is very unlikely to be the same as seeing another naturopathic doctor, but we're all based on this naturopathic philosophy. And most doctors really will say that they are as well. First, do no harm. It's a very important one. The healing power of nature is one of our principles, as well as identify and treat the cause, treat the whole person. Doctor as teacher, this is a very, very important one because so much of what naturopathic doctors do is to really help people take back control of their lives and their health, and helping people to understand what their decisions and their choices and how they contribute to your overall health. And then prevention is the best medicine. That's really core of what we do. So we also follow a basic therapeutic order, and this is what I'm going to go through today to help give you some examples of how you can really try to focus and direct your own health, regardless of the type of doctor that you choose. The first thing that we always do is establish the conditions for health. The second is to stimulate and support self-healing process. The third is to correct areas of imbalance. The fourth is pathology-centered natural care. The fifth is pharmacology intervention. And sixth and last resort is surgery. So I'm going to go through examples of this to see how we can really use this. The first one with establishing conditions for health. This basically means establishing a healthful regimen, making sure that nutrition is a really important part of your life, sleep is a focus, exercise is something that we do regularly, and have general social well-being. We also need to avoid triggers and mitigate any predisposing factors that we might have. I'm putting in here an example of a splinter. If we have a splinter and we're complaining that it hurts, it's not going to get better if we don't remove the splinter. And it's just the same with other things. Another example would be weight loss. And if people are continuing to eat McDonald's 4 times a day, but they won't lose any weight, you can't lose weight if you're eating McDonald's 4 times a day. So removing those predisposing factors is really an important aspect of what we do to help people restore health. And no matter what type of medicine you do or use, if you're using conventional drugs, instituting a healthful regimen will make those drugs work better. Stimulating and supporting self-healing. With naturopathic medicine, we typically use hydrotherapy, homeopathy, or nature cure. I'll go into some of those a little bit more later. Correcting areas of imbalance. This is really a pretty important aspect, because once we get the basics for health established so that people can improve, there's still some things that really need to be worked on. In particular, reintegrating the mind-body connection. I find that this can be really very important with people who have mood disorders, to understand triggers, accept, and work through the feelings that they have. And so I'll have an example or a recommendation for a book to help with that later. Supporting physiological processes is another way that we correct areas of imbalance. This could be something like using temporarily high doses of nutritional supplements with nutrients that will help to ensure that all of the biochemical processes that are required are functioning at their optimal level. Then also making sure that the structural integrity, if it was more of a physical concern, is intact. Then we look at pathology-centered natural care. So this is where a lot of naturopathic doctors will come in. I typically come in stages 1 and 2, and I find that I'm able to stay there. Sometimes I have to go into stage 3. I rarely go into stage 4, but I'm going to give you some examples because this is where things get a little bit dicey and where people will end up either doing self-care by talking to somebody at a health food store and getting potentially dangerous advice. And so, or naturopathic doctors who are not necessarily focused on mental health and don't understand the intricacies of specifically bipolar disorder, which has its own very unique challenges even within the mental health community and the mental health field that make it different than basically any other condition. So with pathology-centered natural care, we're reducing, eliminating, or suppressing the specific symptoms with natural therapies. So the examples that are pretty common that people know, St. John's wort for depression or chamomile for anxiety. This pretty flower over here is hypericum, which is St. John's wort. There's also the use of high-dose vitamins. Some of you may have heard of orthomolecular medicine, or potentially don't even know what that is, but have heard of the use of high-dose B vitamins, in particular niacin and vitamin C, to help treat mental health challenges. And then there's specific nutritional supplementation or physical therapy, like vitamin or mineral deficiency. I'm going to give a few examples of this here. The first example I'm going to give you relates to hypericum, which is St. John's wort. It works by blocking the uptake of serotonin, among other properties, just like Zoloft does. Zoloft increases the serotonin levels in the brain by blocking its natural reuptake. A few side effects of Zoloft are decreased sex drive, dry mouth, vertigo, insomnia, and tremors. An overdose can be seen with tachycardia, which is an increased heart rate, rapid heart rate, sweating, vomiting or diarrhea, and general agitation. If you look at down there a little bit lower, you can see that the same side effects and the same overdose symptoms are present with hypericum or St. John's wort. Similarly, if you wanted to take the traditional or the nutritional method instead of using herbs, which I always want to make sure that I emphasize, and this is a good point to do that, I want to emphasize that herbs are really drugs in crude form. Many drugs are made from herbs that they've located and boiled it down to a single or a few constituents that have medicinal action, and then they use those constituents and they create them synthetically, or they isolate them and use only those constituents. In that way, people who use herbs a lot will tell you that they're losing the interaction of the various parts of the plant as a whole that can help with its functionality in medical purposes. But I want you to keep in mind that if you're taking herbs, you're basically taking drugs in a crude form, and you're forcing your body to do something biochemically that it is not doing on its own, just like you would be doing with any conventional drug. So don't think that just because it's an herb and you can buy it over the counter that it means it's safe and that it won't have any physiological harm. So back to the slide, if we're going on the nutritional aspect, I'm sure a lot of people have heard about using 5-HTP to help with depression. I want you to know that, keep in mind that 5-HTP is basically a precursor to serotonin. And I'll show you the actual flow of it for those of you who are science nerds who like to see that kind of thing on the next slide. But 5-HTP is a precursor to serotonin. It does increase serotonin levels and can therefore have the same type of effect as using St. John's wort or using Zoloft. Similarly with tryptophan, it is a precursor to 5-HTP, which is a precursor to serotonin. Some naturopathic doctors will use this as a way to feed the pathway, to basically force the biochemistry to happen faster and more efficiently than it is on its own. I put down here in red in caution, this is very, very, very important for those of you who have loved ones or yourself have bipolar disorder. You absolutely do not want to use these substances on your own. They, just like using Zoloft or any other antidepressant on its own, can trigger a mania or a hypomania. These natural substances can too. That includes SAMe. I didn't include this in my example, but that is another one that can trigger a hypomania, so you don't want to use those on your own. So this is for those science nerds here, this is the natural production of serotonin. I just want to make sure that everybody gets an idea here that it could be related to nutrition as well. I don't know if you can see my arrow here, but the nutrition aspect here, all of these things, these are minerals and vitamins that are required for the conversion of tryptophan to 5-HTP, and then these are the vitamins and minerals that are required for the conversion of 5-HTP to serotonin. So if we are not having a diet that is rich in these vitamins and minerals, we could be slowing down the process that could be working on its own anyway, and we're just not giving it the tools that it needs to make those conversions. So another example is Xanax. It's alprazolam. It's a benzodiazepine, which the exact mechanism of action isn't known, but it causes a sedative effect. Similarly, we have here in California a wonderful and beautiful plant. It's a Schultzia californica. It's a California poppy. It contains alkaloids that actually cause a mild sedative effect as well. So this can be used similar to using Xanax. People will take it before they're going on a plane ride if they happen to be really nervous in the air. There's also GABA, which is a neurotransmitter, if we're looking similar to the 5-HTP, that's inhibitory in adults and causes a mild sedative effect. For those of you who have children, you want to be very careful about using this if you're considering doing something like this on your own or talking to your doctor about possibly using this. It is excitatory in children. You don't want to give this to try to calm an excited kid down. There's also glycine, which is another amino acid if we're looking at the nutritional aspect, which is inhibitory neurotransmitter, and it causes a mild sedative effect. I meant to add kava, which is Piper methysticum. It's kava kava, which is a plant that a lot of people will use. Sometimes people use it recreationally, but it can be used really as a much stronger than California poppy, a much stronger anxiolytic or sedative. I want to give caution. I don't have research to back this up, but I have experiential evidence from myself and other doctors that if you give this drug or this herb, which is basically, in my opinion, a drug, if you give this herb to somebody who suffers from bipolar disorder, I've had other doctors share that it has caused a very, very deep suicidal depression. And so just another example of how our brains, when we have bipolar disorder, they behave differently and they respond differently. They're more sensitive to external cues. And so trying to use these things to mitigate a specific symptom that we're having could potentially make us swing in the opposite direction. So I just had to conclude this picture because orange is my favorite color and I love this flower. I think it's so pretty. So this is our natural sedative. This is a Schultzia californica. So on our fifth, we have Pharmacology Intervention. So I don't use these in my practice. Most naturopathic doctors here in California, most of us don't. Some other places, they use them more often. I do want to say, I'm going to go back up. I am not opposed to conventional medication in any way. Typically, I refer out to a psychiatrist to manage the conventional medication. I do think it can be very life-saving. And so I think that's always an important thing to make sure that we identify here is that naturopathic doctors as a whole are not necessarily anti-conventional drugs. We just think that it should be used safely and effectively for short-term interventions to help get the body back into balance if needed. And then final resort is surgery. We are trained in minor office procedures, but there's nothing that can be done with mental health conditions with a minor office procedure at this point in time, and I can't imagine that there ever will be, so I don't even know why I said this point in time. So basically, the heart of what naturopathic doctors do is we remove obstacles and we stimulate the body to heal. So what I want to go over, and this is really an area where you can truly get some help at home, is with removing obstacles to health, because any medicine that you use, like I said before, is going to work more effectively if you've removed any of the obstacles to you being healthy as an individual. So some of these obstacles are food or nutrition, water, sleep, shelter, exercise, and toxic relationships, as well as hormonal imbalances. So for dietary obstacles, we're typically looking at food sensitivities, highly processed foods, sugar and artificial sweeteners, and pesticide residues. So for food sensitivities, it's hard. There's a lot of ways to identify them. I'll go over the easiest way to be the most effective and most accurate. There are blood tests that can be done, and some naturopathic doctors do them. I currently don't do them because they're approximately 70% accurate. They're not 100% accurate at this point. What they're doing is they're testing the blood to check for antibodies to certain foods, and that is caused usually by having gut abnormalities or leaky gut, so to speak, where the particles from the food, the proteins from the food, are getting into the bloodstream, and they're the ones that are causing the most inflammation system-wide. The most common ones, so if somebody was wanting to try and remove common food sensitivities to see if it just helped with their mood or their overall well-being, the most common ones are wheat or gluten. So there are some grains that have gluten in them that are not wheat, so it's not specifically just looking for wheat-free. I want to give a little bit of a caution with that. Just like we had years ago the low-fat craze for dietary restrictions, and then everything started to be high in sugar to make up for the taste that was lost by reducing the fat. And then we ended up having an increase in diabetes and in obesity because the sugar actually caused a lot more problems than the fat did. Similarly, we're having some issues with that with gluten. Everybody's buying gluten-free and they're looking just for it being gluten-free and they're not looking at the other ingredients. So what I typically recommend for dietary things is whole foods-based diets, not foods that are processed and say gluten-free. Typically, people who have mood disorders do better with a lower grain-based diet anyway. So wheat and gluten, dairy, corn, soy, and eggs are the most common food allergies. Most people who are tested or who do an elimination and challenge diet come up with allergies to those. Less common but still prevalent are nightshades, citrus, garlic, and yeast. I know that I actually have a sensitivity to garlic that is pretty severe. It's even more severe than any of the other ones that I have that are more common. So this is one of my favorite things to talk about with food and why gluten and dairy can be problematic for some people. Is mac and cheese really like crack? I don't know how many of you have thought that, but or pizza, maybe that's your favorite comfort food of choice. Now, it's more like heroin than like crack. The reason I say this is because wheat contains gluten, which is a peptide called exorphin C, which is an opioid peptide. And if you think about it, heroin is an opiate. Dairy also contains an opioid receptor binding protein called casein. So studies have shown that both casein in dairy and gluten in wheat they bind to the delta and mu receptors for the opioid receptors, and both of those two receptors are related to physical dependence and have mood altering effects. That's why we crave things like wheat and dairy when we are stressed out, because it actually does help to calm us down because it binds to these receptors. But that's why we also have a hard time letting go of them and have a hard time controlling our cravings for sweets and for cheese or dairy products or ice cream. So the gluten-free, casein-free diet, I'm sure a lot of you guys have seen this. If those of you who are on this call are interested in naturopathic medicine and natural treatments. So a lot of times you'll see it as GFCF. There is some evidence that with autism and schizophrenia where it's been researched, not so much with bipolar disorder yet, but typically because of those opioid receptors, most people end up feeling less foggy-brained when they remove those things from their diet. With autism, the research has shown in some ways that it helps to reduce the overall problems with autism. It improves behavior, and it also improves connectivity with others. However, they still found that because of the numbers and the review of the literature that it's inconclusive whether or not the GFCF diet is incredibly helpful in autism or not. With schizophrenia, there actually has been some evidence that there is an increased prevalence of anti-gliadin antibodies, so the anti-gluten antibodies in schizophrenia, meaning that they have an immune response to gluten. And when you eat gluten and you have an immune response, it can have systemic inflammation, which can affect the brain as well. So highly processed foods. This picture over here on the right is probably making some of you drool. Really the biggest problem with highly processed foods is that most of them have those gluten and casein peptides in them, so they're affecting our mood and they're affecting our addictive response. They also have limited nutritional value. So they have a higher ratio of the omega-6 to omega-3, which the reason that's important is because, as we've already been talking a little bit about inflammation and how that really affects the body and the brain, omega-6 tends to be a precursor for more inflammatory processes, and omega-3s tend to be a precursor for more anti-inflammatory processes. They also tend to be high in refined carbohydrates, and they have a lot of food dyes and other additives that just aren't found in nature, which I always try to eat with things that are as close to their state that they would be recognizable in nature. And the reason that these are so problematic is when we fill up on these, we're eliminating the possibility of getting higher nutrient-dense foods into our system, and we're also increasing inflammation of our body, which reduces our ability to absorb the nutrients that we are getting. So it's kind of a double whammy. It's reducing the nutrients you get and reducing your ability to absorb the nutrients. So sugar. I actually wrote a blog about sugar for the International Bipolar Foundation back in December. I felt like it was a really good time to talk about it because it's the holidays, and holidays are typically really tough times for mood control and mood stability anyway. And then there's also all this sugar with all the holiday treats. So what I really want to emphasize in sugar, if you want my top 5 reasons to avoid sugar, you can see that blog on the International Bipolar Foundation website. Right now what I want to talk about is metabolic syndrome and lipids. Triglycerides are the biggest problem because triglycerides are actually made from sugars and carbohydrates. And with metabolic syndrome, a lot of people who are on antidepressants or antipsychotics have metabolic syndrome, which includes increased lipids. And so that's basically central obesity, increased lipids, with reducing our sugar intake, we're reducing some of the impacts that we'll have on with these drugs that people are taking, that we're taking, that are more likely to lead to metabolic syndrome in the first place. So with artificial sweeteners, this is always a touchy subject. The research is not conclusive about what it actually does to the health overall. Some studies show that it's linked with cancer. Some studies show that there's neuron disruption. Some studies say that there's nothing that happens. So at this point, I'm just giving a big shrug. I don't really know what happens with the artificial sweeteners. I don't think anybody really knows. The biggest problem, though, is that people who consume artificial sweeteners tend to eat more calories than those who don't. So if we're looking at overall health, having a healthy body weight, reducing the inflammation, and typically when people are eating things with artificial sweeteners, they're usually not eating healthy foods. So we're typically eating more calories of less healthy foods with the artificial sweeteners than we would if we were eating something that had a natural sweetener in it. And then pesticide residues. This is always, again, a touchy subject, but I want to make sure I go over it so that you've got the information to make the decisions that work best for you. So organophosphate pesticides are present on all conventionally grown produce. They are associated with adverse neurodevelopment, including behavioral problems and cognitive issues. They're also related to insulin resistance, which is a major concern if taking psychotropic medications. So the reason I included these two, there's lots of other things that they're associated with, but these are typically problems that we see when we or a loved one have bipolar disorder or any other mood disorder. Cognitive issues are a big problem, as well as behavioral issues. And then, as we were just talking about, insulin resistance with metabolic syndrome associated with food choices, coping skills with being food sometimes, and psychotropic medications. So some symptoms that are associated with persistent organic pollutants exposure: poor cognition, poor attention, short-term memory loss, depression, fatigue, paresthesia or numbness, balance issues, thyroid dysfunction, decreased sexual interest, and changes in hair growth. Other than changes in hair growth, I don't know about you, this kind of sounds to me like some things that will happen with bipolar disorder and depression. I just thought this was a funny cartoon. I had to include it. Do you also eat those with the mask on? This has been going around on Facebook, so I thought it was an appropriate place to put it. So sleep. Sleep is always a big thing. I'm sure every doctor that you've ever spoken to has talked about this. Mood disorders, especially bipolar disorder, are typically, at least in part, they are disorders of circadian rhythm. There's actually genes that have been found in bipolar disorder that are associated with the circadian rhythm imbalance. So if we were to go back and look at that slide before about the conversion of tryptophan to serotonin, we would also see that another step in that process leads to melatonin. And melatonin is really what is controlling our circadian rhythm. So if we have low serotonin, we'll also have low melatonin. So ways to really maintain circadian rhythm. What we can do with natural treatments is we can basically amplify the signals. What we do to do that is we use light and dark therapy, and that's really all that light and dark therapy are, is they're amplifying the signals to help our body and our brain get back into balance. The thing that I always want to advise, and this is another thing that's like a big caution, don't do this at home necessarily, is that light therapy can actually trigger mania in bipolar 1. So light therapy should always be associated with dark therapy. I have used light and dark therapy with a patient who had bipolar 1 disorder that was very effective at helping to re-regulate their sleep cycle and then also their moods. However, it absolutely was only done because I had tested cortisol levels and found that there was a flip-flop in cortisol, indicating there was a delayed sleep cycle. And so we had to amplify the cues to get his pattern back on track. And it was effective, but there was absolutely no way that I would do it without dark therapy because it can trigger a manic episode. Less intense ways of doing it and less expensive because you have to buy equipment to do the light and dark therapy. With the dark therapy, you need to get blue blocking sunglasses so that you can actually wear them around at night, and also make sure that you keep lights low at night. Right now we're creating an artificial daytime, and this time of year it's not as bad, but in the winter it's pretty bad. We create an artificial daytime and we end up staying up much later than we should, and we don't give our bodies those normal cues that we should. And with all the screens that we've got, we're just constantly bombarded with light, and our bodies aren't really prepared to do that. So a less expensive, less equipment intense way to do it is to just really make sure you keep your activities of daily living sort of on schedule. It can be really difficult. I personally struggle with having a specific routine. I fight against it and I have to fight myself to try to make myself do it. But it's really, really effective and helpful when I do. So keeping meals at regular intervals and consistent from day to day is really helpful with that. Going to bed and waking at the same time, even on weekends, that's always a struggle for most people, but that's really helpful to make sure that you're maintaining that regular sleep cycle. No napping, because that also throws things off. And then regular exercise. I'm going to emphasize this again later, but morning is the best time for mood regulation. There's been studies to show that. So for those of you who have a hard time getting to sleep, here are some examples. I've got handouts that I could send. I'll give my contact information at the end, but I've got handouts that I can send if anybody's curious about some of these more specific things with how to do these things at home. Basically keeping the room dark, reduce noise. The biggest one that I want to emphasize for most people is right here, keeping lights low and limiting screen time at least an hour before bed, and establishing a bedtime routine to signal your brain that it's time for sleep. That's always a tough thing because a lot of people are going to bed with their iPhones or their whatever their smartphone is, or their iPad, and they're watching TV or Netflix as they're going to sleep, or they're playing a game, and they're checking their email or checking Facebook, and that's still giving our eyes the cues that it's still daylight, and it's not giving it that cue that it's dark and it's time to go to sleep. So really trying to limit the screen time for ourselves before bed is important. So hormone imbalances, this is not one that you can do yourself, unfortunately. There are natural treatments that can be used to help upregulate conversion of thyroid and the effectiveness of thyroid, because just as any natural substance that your body produces, there are cofactors that are needed. Those are the vitamins and nutrients that we were talking about with the serotonin. Those are called cofactors that help to make the enzymes work to turn one thing into a different thing. The same is true with thyroid. The thyroid hormone that we need to create and synthesize in our body are cofactors that we can help upregulate or help to improve the effectiveness of the conversion. However, testing is really important to make sure that you know where your thyroid is. Thyroid typically is the biggest imbalance with mental health and especially bipolar disorder. I've found in my practice that if a patient has bipolar disorder and they have an improperly functioning thyroid, and I mean I basically mean an optimally functioning thyroid. The numbers I look at are maybe a little bit stricter than another doctor would look at. If it's not functioning optimally, they're not going to respond as well to any treatment. My treatment, conventional medicine, orthomolecular medicine, anything, if their thyroid's not working as well. So that's always a big area of emphasis for me, is making sure thyroid's functioning properly. And the last is toxic relationships. This is pretty, it can be really tough. If you're caused consistent anxiety because of a bad boss, the anxiety is not going to go away as long as you're working for that bad boss. Unhappy marriages too, if there's an abusive or toxic relationship, it's just, you can't really get past that because it's a trigger. Like we talked about, removing a trigger. It's just like removing a splinter. If that's a trigger and it's a bad thing for you, you have to remove those triggers before you can really get better. And that can be a really tough one to go through. I made an emphasis down here at the bottom that caregivers really need support too. So those of you who are on this webinar who are caregivers for somebody who has bipolar disorder, don't neglect yourselves. This can be really, it can be really challenging to be a caregiver of somebody, especially those of us who are sicker. It can be very challenging to be a caregiver for somebody whose mood is by nature and by the nature of the disease itself is unstable. So making sure that you have your needs met and your health as a priority will help to make sure that the relationships that you have with your significant other, your child, your friend, don't become toxic either. Okay, and exercise. Again, here I emphasize on the bottom, morning is better for mood stability. I always have my patients aim for 30 minutes of the day, most days a week, and I tell them to make sure that they actually get their heart elevated for those 30 minutes. It doesn't have to be an hour, it doesn't have to be a long thing, it's just get your heart elevated. If you can go for a brisk walk and that elevates your heart, then that's all you need to do. If you're somebody who's pretty intense and you need to do a lot more like the high intensity interval training, then that's great, but it's not required of everybody. It really does help enhance mood. It decreases depression and it decreases anxiety. And it really helps to regulate sleep patterns as well. So what can you do at home? You can really focus on eating more fruits and vegetables, less processed foods, eating organically grown when possible. And I'll give you some tips on how to do that on a budget here in a minute. Eating lean proteins as a primary source of your meals, with that being the focus, and not carbohydrates as the focus. And then omega-3s can be very helpful. There have been studies that have shown that high doses of omega-3s can be effective in reducing depression. I believe the amount though is like 6 to 9 grams. So you want to find a good quality fish oil that is also easy to take in that type of amount. Usually liquids are easier to take than pills. So reducing fast foods, sugars and artificial sweeteners, and foods that come in packages. So for a typical shopping guide, I tell patients to stick to the outsides of the grocery store. I don't know if you've really thought about it, but all of the stuff that is found in the form that it would typically be found in nature tends to be on the outside and along the back of the grocery store, and everything that comes in boxes that nature wouldn't recognize is in the middle. So I tend to suggest that my patients, that if they do the best, if the one thing they make is a change that they make in their shopping is they stick to the outsides of the grocery store, they'll do better. For those of you who are on a budget, which most of us are these days, and you want to try to reduce your exposure to the organophosphate pesticides, the Environmental Working Group publishes a guide every year, a shopping guide that you can print out, or you can even request a small pocket guide to go into your wallet that gives you what's called the Dirty Dozen and the Clean 15. So the Dirty Dozen are the fruits and vegetables that are most likely to be affected by the pesticide. Typically, those are things that have thinner skin or more porous skin, where the pesticides will become embedded in the part that we're actually going to eat, whereas the things that have a hard skin or a very thick skin that we remove are less likely to be so. So I always tell my patients, and this is what I try to do myself, I try to buy organic when I can. It's not always feasible, and I try to stick to monitoring the Dirty Dozen and Clean 15. The Clean 15 are the ones that are the least likely to be affected by the organophosphate pesticides and can therefore always be bought conventionally, which is a little bit cheaper. When it comes to the proteins, if possible, I suggest grass-fed and finished beef and wild-caught fish. The reason I suggest the grass-fed is because it has a higher ratio of the omega-3s to omega-6s And as we talked about before, omega-3s are reducing inflammation and omega-6s are increasing inflammation. The other bit that I always make sure that people know is that you should always assume that farmed fish are, that Atlantic salmon is farmed. And when it's farmed, it means it has higher levels of mercury and other exposures, and the way that they're fed can increase the pesticide residue as well within the flesh of the fish. So I typically suggest getting the wild-caught Alaskan salmon is usually the best. So the Environmental Working Group also has some information on more and less toxic fish selections for those of you who are big seafood fans. You can find that on the website that I linked up there, www.ewg.org. So for food allergies, the best way to discover them, if you want to try to limit food sensitivities, if you think you might have a sensitivity, track what you're eating. The absolute gold standard way to do this is an elimination and challenge diet, where you eliminate all possible foods that they're typically allergens, and then reintroduce them one at a time. It's time consuming and tedious. It's not an easy thing to do. I've done it. It was challenging socially. In my practice, I recognize that with mental health conditions, that there are typically challenges in the social aspect, and that's so important that I try not to include anything in my treatment plans that could be limiting socially, and doing an elimination and challenge diet can be limiting socially. So I just suggest that people keep track of what they've eaten and what their symptoms are, and keep in like the time frames too. So if you can see a pattern that I ate this thing at 2 o'clock and by 4 o'clock I was depressed, and that happens 2 or 3 times, maybe you're kind of sensitive to that thing that you ate, and maybe it's not serving you very well to have it. Some sensitivities will take up to 5 days to have a response, but that's typically things that are not as strong and the things that you're not eating every day. And that's more important if we're doing an elimination and challenge diet. So before doing any of these things that I'm talking about, you need to talk to your doctor, because you have to make sure that none of the things that you're taking currently will interfere with them. Because as we talked about, drugs and even nutritional things and herbs, they can all interact, and because they have similar effects on the body, they can change your brain chemistry, and they can change it in a way that can be detrimental. So you want to talk to your doctor before you start taking anything on your own. That's one reason that naturopathic doctors are so sought after these days, is because we are truly the experts in these interactions, because we have the training in pharmacology and in the natural treatment. So we really understand exactly how they're working. Most people will benefit from taking a multivitamin. Like we talked about before, they provide the basic nutrients for those physiological processes, like we looked at in the serotonin pathway, and we talked about in the thyroid pathway as well. A lot of people who are struggling with their mood don't eat as well as they possibly could, and so probably missing some vital nutrients, and an easy first step to try and increase that is taking a multivitamin. Fish oil, again, good anti-inflammatory. An example of how to know if it's a good fish oil or not, because some have better quality than others and have better testing to ensure purity. But typically good quality fish oils will not smell or taste fishy. So if they smell or taste fishy, it's probably not the best one, and maybe even going rancid. And then probiotics, they're kind of a big rage right now. They can help reduce the reaction to some food sensitivities as well. So as we talked about before, emphasize regular routines and meditation. This is the book that I mentioned earlier, The Mindful Path to Self-Compassion. This was a very helpful book that I found for myself in teaching people how to do some basic meditation, to understand what it is that they're feeling instead of just reacting to it with an emotion. So I want to talk a little bit. I know we're getting close to the end, and I'm sure there's lots of questions, so I'm going to make sure that I save some time for that. But I want to talk to you a little bit about what I do in my practice to stimulate healing after I've removed these obstacles. So what I use is primarily homeopathy. That was a homeopathy vial right there. Homeopathy is a truly holistic medicine. It is based on the principles of like cures like, originally posited by Hippocrates. It is a system of treatment based on observation and the scientific method, and is demonstrated to be effective through clinical trials. The way that homeopathy actually works is it's been tested on humans throughout the last couple hundred years. Substances that are found in nature have been tested on humans who are healthy to see the symptoms that they produce. And so all of our information that we use in prescribing are tested on humans and based entirely on observation of the symptoms that they produce and then the symptoms that they help to remove. So it is truly based on observation and the scientific method, and it's the only form of medicine that has ever been solely tested on humans. It's also the safest form of medicine. It's so safe it can be used in pregnancy, in nursing mothers, and in children. Homeopathy is not just giving an ultra-dilute preparation of a medicine. It is not naturopathy. I am a naturopathic doctor, and I do use other therapies to help ensure that I'm increasing vitality and supporting the healing possibility of homeopathy. So many naturopaths will use homeopathy, but they're not synonymous. And homeopathy is not isopathy. What isopathy means is using the exact same thing that would be the infecting agent. So people always think that, or often think that, homeopathy and vaccines are the same thing because you're giving the small amount of the infective agent to somebody so they can produce antibodies to it. It's not that. It's using something that would cause similar symptoms in a healthy person. So homeopathy is an applied system of medicine and pharmacology that describes how to use medicine. It's not the medicine itself, it's how to use it. They're dilute doses of single substances that are found in nature. And when prescribed accurately, they stimulate the body to heal. Homeopathy works by doing this, by stimulating the body to heal, and by removing the symptoms, which are the only indication of disease, and works at the underlying level of susceptibility to disease. If you think about it, using an example of like a cold, if we were all sitting in the same room here and 4 of us had a cold, those of us who are sitting around may be more susceptible to getting a cold, but you could be sitting right next to somebody who has a cold and not actually get it. That's because you don't have the susceptibility at that point, whereas others do. So any condition has a susceptibility to it. Those of us who have bipolar disorder, we have a greater susceptibility to bipolar disorder than those who don't. Similar events in life can trigger episodes with us, whereas they don't with others. And even within a family, not everybody in one family has the same conditions either. So homeopathy works, but how? That's always a question. And I had that question too. When I first started naturopathic medical school, I didn't understand homeopathy. My background is in physiology and neurobiology. I was worked for the government. I was in the military. My brain is just very structured and very regimented, and this plus this equals this, and homeopathy didn't make sense to me. So I needed to look up the research on it. And to be perfectly honest, it's still fairly inconclusive. I'm not going to lie. There's some of the mechanisms that have been proposed and research that has been done. There's a study by Rustum Roy suggesting and demonstrating. He actually had pictures in one of his debates that he participated in that showed that the preparation process for homeopathic medicines changed the structure of the water. And when you think about it, the structure of the water is what really dictates how it affects the body. So if we were to drink water, we can drink water, but we can't drink ice and we can't drink steam. We can use ice to cool ourselves down, but steam burns, and water at room temperature doesn't cause either of those things. It's just nice and we clean ourselves with it. So if you really think about just water without anything added to it, with any preparation, the way the structure of the water itself really affects how it affects our cells and our body. So this is one suggestion about how it works. Here's another copy or a different version of this if anybody wanted to look these things up. Another mechanism was suggested that nanoparticles are actually what are being created with the preparation process. That the way that that homeopathic medicines are prepared is with what's called serial dilution and succussion, or really vigorous agitation or pounding of the remedy to make sure that it's actually apparently to make nanoparticles. The reason that they did that is they found years and years ago, without any reason, they tried it one way with the pounding, without the pounding. If you don't do the succussion, it doesn't work. The succussion is a vital part of the homeopathic process, so it does suggest that it's actually altering it somehow. So when it comes right down to it, the reason I use homeopathy for myself and for my practice is because it works. And there are some studies that show that it's been effective in mental health concerns. This particular one is not a mental health concern. This is a chronic disease. It was a long-term study, observational study of people in the National Health System in England, I believe, that of the over 6,000 people who were using it, 70% reported positive health changes and 50% were better or much better. This is a more impressive study, I think. This is a long-term study, again, an outcome study based on homeopathy versus conventional medicine. There were more people who used homeopathy in this case than the conventional model, but percentage-wise, we had a greater impact in treatment, response to treatment, almost 20% greater with homeopathy than with conventional. Improvement in 3 days or less was over 10% better, whereas the adverse events were less than, almost 15% less with homeopathic treatment than with conventional, and much greater satisfaction as well. So for ADHD, there's been some studies that have suggested that homeopathy is effective in the areas of behavioral and cognitive functions within ADHD, and that's mostly what we're trying to treat with conventional drugs anyway. Homeopathy versus Prozac. This study wasn't really done to show how effective homeopathy is instead of Prozac. It was mostly a demonstration of how a double-blind placebo-controlled trial could work with homeopathy. So this wasn't trying to demonstrate that it was better. It was trying to demonstrate that it was not less effective. So it was non-inferiority trial, and it did come up that way, that there was no inferiority of using homeopathy to using Prozac. It did, however, find that there was greater treatment interruption and adverse events for people who were using Prozac than there was for using homeopathy. So homeopathy works. I see it daily in my practice, and ultimately when I talk to people who don't understand it, that's what it comes down to me. We don't have the exact answer about how it works. I'm sure we will someday. We're continually advancing in things. We didn't even know nanoparticles existed. Once upon a time, we thought that the atom was the smallest form of matter, and we found later that it's not. So I see it daily in my practice. That's really what matters. I see people get better. I see people who are suicidal and then not, and the only thing that's changed is their homeopathic medicine. I've seen people who are violently agitated calm down very quickly with homeopathic medicine. So homeopathy works, and I see it on a daily basis in my own health. I gave a webinar for the International Bipolar Foundation back in January that's sharing my story. You may have noticed I've been saying we a lot with bipolar disorder, and that's because I actually do have the diagnosis of bipolar disorder. It was made years and years ago, and I've recovered from it. And so the name of the webinar, if you haven't watched it or are interested in it, is From Mental Illness to Mental Wellness, a story of hope and recovery. So if you want to know more about me and my story, feel free to listen to that. So this guy right here, this is Samuel Hahnemann. I'm going to go through these last little bits here pretty quickly. He was the founder of homeopathy, and he was the first physician to ever use any type of compassion with treatment of people who had mental health conditions. He was quoted as saying, "The doctors, from a humiliating consciousness of their uselessness and mental illness, vent their spite at the apparent incurability of mental disease in harshness towards innocent sufferers." This was a huge thing for somebody to be saying back in the late 17, early 1800s. He actually was the most effective in treating mental health conditions when people were locked up in asylums that were indecipherable from prisons. I'll skip past this so we can make sure we've got more time for questions. So what homeopathy requires is the removal of obstacles to healing, which is why I put so much emphasis on that, because just like any other type of medicine, homeopathy really requires you to be able to get well and not have things that are standing in your way. It requires a detailed understanding of your health concerns as a whole. That's one reason it's really important to have somebody who is a doctor, who is a good diagnostician as well, because we need to understand your condition and what sets you aside to find an individualized treatment for you based on your unique symptoms, because we don't all experience this the same way. My experience with bipolar disorder is very different than yours. I mean, you may listen to my story and you may have a lot of things that you feel in common, but my exact symptoms that I experience are different than yours. And so the medicine that will help me to get better isn't going to be the same as the medicine that will help you to get better. So that's why we need a detailed understanding of the diagnosis to know what's common, what's not common. There's a common thread that we all experience when we have this condition, but it's the unique individual symptoms that really matter. And then there we go, individualized treatment based on your unique characteristic symptoms. So the reason people come to me and use homeopathy is they get rapid, noticeable symptom improvement, symptom relief through healing and not suppression. We're not forcing the body to make things, we're not forcing any biochemical pathways. We're stimulating the body to do that on its own. Eventually people are able to discontinue homeopathic care and not have any strong adverse effects if they've actually reached the point where they've significantly improved. There's no side effects or harmful drug interactions. A lot of people are able to reduce or eliminate the need for medications. I, for one, was able to eliminate medications and have been off of them for over 5 years without mood episodes. And patients feel listened to and understood. We do a very detailed intake to really understand everything about what you're experiencing. And so sometimes people will tell me that often people tell me they're telling me something that they've never told anybody else, and that they've got they think I have a better understanding of them than their therapist, whose job it is to talk to them, and my job is to actually find a medicine. And most people, they end up feeling like they feel like themselves again, instead of somebody who's been numbed from medications that are meant to suppress the strong emotions. I know that was a big problem with me. So the last thing I want to leave you with before we get to questions is, just because it's natural, it doesn't mean it's safe or best suited for you or your loved one. That's the most important thing I want you to take home. Mental health conditions are complex and only moderately understood by the medical profession. So consult with a trained professional before trying any natural treatments, and make sure that if you're on any medications that they're not going to interfere with the things that you're using already. And then make sure your doctors talk to each other. That can be problematic in some cases. Your doctors if you're using conventional and natural treatments, all of your providers need to know everything you're taking to make sure that they don't change anything that could cause you a significant problem. And unfortunately, there's been some studies in the public that show that people aren't talking to their doctors about the natural supplements that they're taking, and then having adverse events because of that, because it's not innocuous. It does change your body's chemistry, and just like the medications do. And the last and most important message is, removing obstacles will improve response to any treatment, whether it's natural or pharmaceutical. So I have time for questions if anybody. And also donate to the International Bipolar Foundation. They're great. I adore them. I think you should. You probably all do too, and that's why you're here. So donate if you can. Here's the link to donate, and then I'll leave my contact information up for anybody who needs that, but I'd be happy to take questions.
Thank you so much, Jennifer. We do have a question. Can a homeopathic treatment substitute a lithium treatment for a bipolar type 1 patient?
So when I do homeopathy, I have helped people with bipolar 1 who were on lithium or other mood stabilizers. Some people want to get off of their medication entirely. Typically, I don't ask that anybody change anything when we first start medication. My intention is to help people live well, not to reduce medications or get rid of medications that are working and not causing really bad effects or anything like that. Because I don't want to put people in crisis just for the sake of getting them off of medications. So I have effectively helped people to reduce or eliminate their need for medications, but it's not an overnight thing. We don't just swap one for the other. We have to make sure people are healing first and improving before we can, and that they don't need the medication as much anymore, so that they can remain stable.
Great, thank you. The next question. Have you included additional support with energy work like the SCIO quantum biofeedback or neurobalance, where you balance your hemispheres with sound?
I'm not as familiar with the last part. Biofeedback can be very effective for managing triggers and managing physiological responses, and as well as, there's a lot of comorbid conditions, including migraines. I personally suffer from migraines. About 50% of people who have bipolar disorder suffer from migraines. So helping to manage the physical symptoms, biofeedback can be really helpful for, as well as then managing the mood symptoms that are associated with the physical symptoms. Neurofeedback can be effective for anxiety and depression. There hasn't been really good evidence to suggest that it's effective for bipolar disorder, unfortunately. Right now, in my personal practice, we don't have biofeedback and neurofeedback as an option, but I sometimes will refer for neurofeedback and biofeedback to other areas.
Great, thank you. I don't see any additional questions. I would like to add that all of our presentations, including Jennifer's today, are recorded and archived on our website. So if there's anything you missed, you can go back and watch the video. And I want to thank you so much, Jennifer, for your time today. We very much appreciate it.
Thank you for having me, and feel free to contact me at any of these numbers here, or my email, if you've got any further questions about anything that I talked about today.
Thank you.
Thank you.